Amen.
Okay, alrighty guys. So as I mentioned, we're going to be talking about dealing with depression. And what I want to focus on today is the idea of faith, meds, and therapy. Because when we're thinking about depression, all three of these components are going to be integral to being able to successfully handle the challenges that exist when it comes to depression. So just as a sense of kind of what I'm going to be talking about today, what I want to focus on really is spiritual health versus mental health. And I want us to really have a firm understanding of the difference between the two, because I think sometimes spiritual health and mental health get intertwined because they are very interconnected, but they're different. And I want us as Christians to be able to have a firm grasp on the difference between our spiritual health and our mental health. And I have quite a few verses that I'll share with you all to really be able to differentiate between these two. And then we'll talk about recognizing depression. I think it's important for us as women, as Christians, as Black women, a lot of us are of Caribbean descent, to be able to recognize what depression is. Growing up as Black women, especially those from the Caribbean and in the church, we don't really ever have the opportunity to learn about what depression is. And it's important to know what it is so that you can identify it in yourself or in others. And then I'll talk as well about treating depression, and that really goes into what I mentioned before with faith, meds, and therapy. I think all three of those together is the best way, especially coming from a Christian background, that we can successfully tackle depression. And do you guys see this random red thing on the screen? I don't know where that came from. Or is that, do you guys see that?
Yes.
Yes.
I don't know what that's about.
It's probably things where you can add something and the finger just went and you need to erase it.
Yeah.
Interesting, but I didn't do that. It just like popped up.
Yeah.
Let's
Sometimes
see.
it just
Annotate. Undo.
Okay.
Oh, it's gonna bother me. I don't know. Clear all drawings. There we go. All right, it's gone.
Mm-hmm.
Okay. Yeah, because that would, if that were there, that would just bother me a lot. All right. So going on next and trying to figure out the best way to advance these slides on here. Here we go. So one really important disclaimer I want to make sure to differentiate is that the content here in this presentation, it's not to diagnose, it's not to treat, and most importantly, it does not establish a patient-doctor relationship between us, but really it's for me to be able to inform you and to really start a conversation about depression. So a little bit about me, because I cannot assume that everyone knows who I am. My name is Dr. Atasha Jordan. I am a psychiatry resident physician in Philadelphia. I was born in the Caribbean. I was born in Barbados, and my family's from there. My parents both go to church at GCA. My family, sister and brother as well, we've been going to GCA for the past 15 years, which for me is honestly kind of crazy to think that it has been that long, that I'm now like able to start counting life in decades is kind of crazy to me. But I have been at GCA for 15 years now. I studied neurobiology in college. I went to Harvard and graduated in 2013. And in addition to neurobiology, I studied global health, health policy, and French. And after I went to Harvard, I studied to become a doctor. So I studied and received my Doctor of Medicine degree just last year, as well as my Master of Business Administration from the University of Pennsylvania. And I really wanted to give that background because, again, I'm coming from a place where, as a Christian, as a Black woman, as a woman from the Caribbean, coming from communities where depression is not at all emphasized and talked about enough, and just really wanting to know that I've been there and understand that it can be uncomfortable, but I want to help to make this as uncomfortable for you all as possible. And then the last point on this slide is the fact that I'm a blogger. So my website, atashajordan.com, I actually have a series on there called Psychiatry in 60 Seconds. And it's a combination of videos as well as written blog posts that help to kind of give information on a variety of topics. So whether that is substance use disorder, psychosis, depression, finding a therapist, things like that. Later on, definitely feel free to check out my blog, because especially the Psychiatry in 60 Seconds series, because I think it can be very beneficial to you from an information standpoint. So next slide. Okay. So really just to kind of jump into things. So what I want to first kind of lay the groundwork on is being able to differentiate the spirit and the mind. Because as we're thinking about depression, we want to see what is the difference between our spiritual health and then what is our mental health. How are they interconnected? How are they different? And how can they actually help to support each other as we're thinking about our mental wellness going forward? So here I'm going to line out the difference for you, spiritual health and mental health, really saying that these two are not the same. So on the left here are spiritual health. And I don't know if anyone actually has ever outlined this in this way, but I looked it up because I wanted to have a concrete way to describe this for you all. And the definitions I found in literature, honestly, actually, I think are beautifully outlined in a way that can be very much supported biblically, and I'll get into that in just a little bit. But our spiritual health is actually our sense of self, our sense of greater purpose, and how that is connected to, and how we are connected to others, to nature, and higher power. And for us as Christians, obviously, that is our connection with God, our connection with Jesus Christ. And our spiritual health together is how we connect ourselves and our purpose with that relationship with Christ, our relationship with others, and with nature. Mental health, on the other hand, now that is related to your emotional well-being, that's related to your behavioral well-being. And those are things that are based, and your mental health is based on your biology, your neurology. So neurology being the neurotransmitters, the chemistries in your brain, the neuron connections. It's related to your environment, and it's related to the social experience that you have as well. So just kind of being able to say mental health, spiritual health, they might seem kind of similar, but they're actually quite different when you compare the two side by side. So first, spiritual health for Christians. What I want to be able to do here is really just kind of go through these different components of spiritual health using the Bible and verses as ways to support this. So first, when we're thinking about our sense of self, when you think of yourself, like, what is it that you think about? They're the personality traits. So for me, I like to say I'm a Christian, I'm a sister, I'm a daughter, I'm a friend, I'm a physician. Those are some of the things about me that define who I am. And in the Bible, what we see here is we have, for example, in Psalm 46:5, we have this verse that says, God is within her, she will not fail. And the sense of self is really important to be able to recognize who we are and whose we are. That relates later on to the connection with God. But with our spiritual health, the sense of self is so key. This other verse, Proverbs 31:25 says, she is clothed with strength and dignity, and she laughs without fear of the future. So again, all of this is related to who you are, and in your spiritual health and your spiritual strength, knowing who you are and whose you are is so key to that. The sense of purpose, I love this verse here, 1 Peter 2:9. But you are a chosen race, a royal priesthood, a holy nation, a people for his own possession, that you may proclaim the excellencies of him who called you out of darkness into his marvelous light. And for me, I think this verse is so important because, again, part of our spiritual health and spiritual well-being is knowing who we are and why God put us here on this planet. And as you're able to get a stronger grip on that by communicating with others, by reading the Bible, by connecting directly with God, that's how you're growing your spiritual health, by knowing who you are, whose you are, and continuing to work on that on a daily basis. I think then the next thing that I want to talk about is connecting with nature. And honestly, I don't know how often we think about this as Christians, of how important it is for us to be connected to the beautiful nature that God has for us. I was talking to my mother recently about this idea that she found online called forest bathing, which is basically this concept that by going out into nature, you're able to cleanse your mind and be able to cleanse your spirit in many ways. And that related to with me, because I don't know about you, like I love being in the outdoors. I like to go hiking. I love being at the beach. And this connection for me is actually where I feel very spiritually at home. And thinking about it this way, it actually brought an entirely new meaning to Psalm 23 for me. And thinking of our spiritual health and connection to nature, just reading through Psalm 23. So it says, the Lord is my shepherd, I shall not want. He maketh me to lie down in green pastures. And when you're thinking of that connection to God, like, I don't know about you, but this to me is just absolutely beautiful. The fact that God is telling us, first of all, he maketh me lie down. So he's telling us we need to pause. A lot of times in life, we're going. With the pandemic, that in many ways has caused us to pause. But God wants us to lie down and lie down in the green pastures. So for you guys, I don't know where it is you like to go when we have our church picnics. Sometimes it's like maybe Peace Valley. What I've been loving to go recently is the Wissahickon Park. It's absolutely beautiful and right here in the city. And God is telling us, as the shepherd, he's making us to lie down here because for our spiritual health, we really want to be able to connect with the nature that God has created for us. He leadeth me beside the still waters. Again, God is encouraging us and telling us to connect with the nature that he has created for us because it restores our soul. So when we're thinking about the spiritual health, really thinking of our soul, our self, our purpose, connecting with nature, connecting with others is the next part that I want us to talk about, because as we're working on our spiritual strength, we need people. Like, that's one of the cool parts of us having a church body. It's that we have people who can hold us accountable, people who can teach us to grow in our strength and our community with God, our connection with God, which is ultimately the most important part of our spiritual health. And here in Psalm 62, 5-6, it says, only God gives inward peace, and I depend on him. And I really want to pause there. And I want you for a moment just to think about what does inward peace look like for you? And I'll just give you a moment to think about that. What is that inward peace? And I want you to think about that inward peace because as I continue on this conversation, I want to just emphasize the difference between inward peace, which is truly coming from spiritual health, meaning that your connection with God, your connection with others, your sense of self, your sense of purpose, those are all so strong that you have this peace in your spirit and you're able to depend on God. But at the same time, I want us to recognize that that inward peace is not the same as mental health. You can have a strong spiritual center and still have a mental illness. You can be at peace in your spirit with God and still have depression. And I think that sometimes what we have conversations about is the idea that if you're having mental health issues, that you're not spiritually healthy. And that is not necessarily true. It might be true, but it's not necessarily true. And that's really what I want us to be able to differentiate here, is that the spiritual health actually is not related to our mental health. And that's what I'm going to get into next, as to understanding now that we have a sense of the spiritual health, how's that different than the mental health? So going forward, and just wanting to kind of remind you here, as we're differentiating these two: spiritual health, sense of self, purpose, then connection with others, nature, and higher power. But then mental health being our emotional well-being, behavioral well-being, based on biology, neurology, the environment, and society. So now going into mental health, and again, because I think it's so important for us to think about this from a biblical standpoint, because I think, yes, there are all the things, and I'm going to teach you some of the things that we learn in medical school and as physicians that we rely on from a clinical standpoint, but I think as well our mental health, because as I said before, spiritual health and mental health being so interconnected, the Bible talks about mental health, and it talks about the fact that people suffer in different ways based on emotion, based on behavior. So in terms of emotional well-being, so looking at Philippians 4:6, Philippians 4:6 says, "Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God." So here, what I want to focus on is what exactly is emotion, because before I talked about spirit and that connection with yourself and purpose, but emotion, so we're going through the spectrum: happy, sad. Here we're talking about anxiety, anger, disappointment. Those are the emotional states. And one of the things to recognize is, yes, everyone has emotions, but when we're thinking about mental illness, it's when we have an inability to cope with these rising emotions, or the emotions we have are so strong and so triggering that it actually is impacting our ability to function on a daily basis. So here, do not be anxious about anything. I 100% agree with this. And I think us as Christians, we're saying that we don't want to have anxiety about anything. But at the same time, we have to recognize that some people, because of their biology, that's their genetics, the genes that they were given, because of their neurology, the serotonin, the norepinephrine, these different chemicals in the brain, because of where they grew up. Maybe they grew up in an environment where they were always in worry, whether in society they had good diet or things of that nature, that some people are actually going to just have a different level of anxiety than others. And with that, so here this verse is saying don't be anxious about anything, but you know what? There's some people who are actually anxious about everything, and that's called generalized anxiety disorder. And I think for us as Christians, it's important for us to be kind and understanding, where when we're telling people not to be anxious about anything, understanding that yes, our faith is integral to us being able to come out and have success on the other side of mental illness. But to say that it's the only thing, I think, does a disservice to those who are truly suffering because of their biology, because of their environment from these illnesses, for example, generalized anxiety disorder. Another example here is Psalm 30, verse 5 says, "For anger lasts only a moment, but his favor lasts a lifetime. Weeping may stay for the night, but rejoicing comes in the morning." And here again, I think the second part, especially the weeping may stay for the night, everyone at some point has been sad. Like I don't know how you can exist on this planet where even with what we're going through right now with the recent killings of Black men and Black women in this country, how you cannot weep, how you cannot be sad and have these emotions. But recognizing, as the Bible says, rejoicing comes in the morning. But at the same time, for some people, that morning takes a while. It might not be the next day. And depending on how long you are in that state of weeping, in that state of hopelessness and sadness, that's really where you want to start thinking, is this a normal and a regular experience of sadness? Or is this something more serious that we need intervention from a primary care doctor, from a psychiatrist, about to be able to actually handle this mourning period to eventually get us to the rejoicing that comes on the other side? So I'll get into more details on that a little bit later, but wanted to just kind of lay some of that groundwork. Then the other component of mental health is the behavioral well-being. So we have our emotions, and we have, as I lined out before, whether it's the happiness, sadness, and how it is that we deal with that. But then there's also the behavior. So for instance, a hot-tempered person stirs up conflict, but the one who is patient calms a quarrel. Proverbs 24:8, losing self-control leaves you helpless as a city without a wall. So with all of these things, actually our spiritual health a lot of times is what encourages us to have appropriate behavioral well-being. But again, sometimes if you are actually having depression, anxiety, or generalized anxiety disorder, some of these things might be out of whack even if your spiritual health is intact. So what exactly is depression and how can we recognize it? This to me is probably one of the most important parts of this presentation, because sometimes we are experiencing, honestly, some of us might be experiencing depression and not even recognize it and just think, you know, if I keep praying, things will go away. But you actually might need some things in addition to prayer to help your depression to be able to improve. So what we have here is a list of some different signs and symptoms of depression. And I'll kind of list this all out, but then go into detail a little bit further on. So the Diagnostic and Statistic Manual of Mental Disorders is actually where this came from. And within psychiatry in particular, we use this handbook to be able to diagnose patients. So again, just like if you have diabetes, if you have high blood pressure, a primary care doctor is going to look at your blood pressure. If you're over 140 over 80, they're going to say you have high blood pressure, and that's the guideline that they're using. For diabetes, if your blood sugar, if your hemoglobin A1C is over 6%, they're going to say you have diabetes. So similarly, if you have a certain combination of these signs and symptoms, that's how psychiatrists are able to say you have depression and you might have major depressive disorder. So there's hopelessness, there's depressed mood, sleep changes, appetite changes, loss in interest in activities, decreased energy, difficulty concentrating, increased guilt, thoughts of suicide or self-harm, and slowed movement or slowed speech. So what I want to do is to actually go into these in a little bit more depth. So first, thinking about the emotional standpoint, because before what I said in mental health, it's the emotional and behavioral wellness that's impacted by our biology, neurology, the society, and environment. So on the emotional standpoint, hopelessness, depressed mood, these are probably the two of the most important things to think about if you feel like there's no hope, like there's something going on and you don't have any way of how you can come out of your current situation. That's the hopelessness. Depressed mood, that's where you're sad, you're unhappy and going and feeling that way for quite some time. And what that can actually lead to is then emotionally having a loss of interest in activities. So let's say you're someone who loves to cook, someone who likes to knit, or you like to travel, or any of these other things, but you find yourself physically unable to do it, which is out of character for yourself. Whether it's like, let's say you're reading, or even if you like to watch TV and you can't even get yourself to do those things, that's one of the signs that you might be suffering from depression. And I'll go into, again, detail later on to show exactly the combination that might be more worrisome than others, because you might just have one of these and it might not be full depression. You might just be in a depressed mood for a few days. And your spiritual health, that is you being able to be connected with God, connecting with other Christians, can help you to recover from that shorter period of a depressed mood. But if it goes on for more than 2 weeks, which is what I'll talk about later, then that's where, from a clinical standpoint, we start becoming concerned. And then obviously, if you're having any thoughts of suicide or self-harm, that's where the emotional side of things can truly become detrimental, and why this conversation for me is so incredibly important. Because if we brush this under the rug and try to say that it's just our faith that will allow us to come out of this, we are truly doing a disservice to others by setting them up to potentially end up in this place of wanting to hurt themselves and end their lives, which is obviously something that we want to be able to avoid. On the other hand, so then there's the behavioral changes that occur in depression. So we have changes to appetite. So that could be actually either eating more or eating less. Changes to sleep, again, that change could be sleeping more or sleeping less. Decreased energy. So like, let's say you're sleeping 14 hours a day and you still have no energy throughout the day. That's a sign. That is a sign that you might have depression, that you're just so sluggish despite however much sleep you're getting. Your body, the biology, the neurology is working in such a way that you're not able to function in the way that you had been before. Difficulty concentrating. So this could be at the level of in your workplace, you're not able to work for as many hours in a row, or not be able to complete tasks as quickly. But it doesn't have to be that severe. It can even be in your own home environment. Like if, let's say you're someone who loves to read and you wake up in the morning and normally you can read 5 chapters of the Bible in the morning, but you find now all of a sudden it's taking you that same amount of time, but you're only getting through a few verses. So those are the subtle things that we want to make sure that we're thinking about for ourselves or for our spouses, children, friends, seeing these changes that might happen. And honestly, can a lot of times be kind of subtle unless you're looking out for them. I think increased guilt is another one. So whether it's anything you're doing, like you feel like you're not able to do things right, another way that the behavioral side is impacted when it comes to depression. The last one here is thinking about reduced speech and physical movement. So what we call that is psychomotor retardation. Really just saying that, let's say, you might need to mute somebody. Thank you very much. And so with the psychomotor retardation, we are thinking about this idea that your speech might be a lot slower than previously. Or let's say you're like in the kitchen and you're like chopping things up and you're the one who's normally able to like go. But now you find that just to be able to get into the kitchen, you're not able to do things as quickly, or taking out the trash is taking you that much longer. Just anything that you're doing regularly, you're doing it much more slowly. That's another sign that collectively points towards depression. So now what I want to do is to put that all back together and really think about how, as a psychiatrist, we diagnose depression. And specifically what I want to talk about is major depressive disorder. So here again, these are all of the symptoms that I kind of just outlined. And when we're thinking about depression, where it's beyond just, I'm in a funk, because everyone at some point has a funk, where you're not feeling that great, but then you're able to use your spiritual health to be able to overcome it. Some people can't do that. Some people, if let's say you have 5 or more of these symptoms, and one of them has to be the ones that are starred, so loss of interest or depressed mood, if you have 5 or more of these for 2 weeks or more, that's a clinical diagnosis of depression. And that's where we then get into the conversation that we need to go beyond faith. And I know that you might want to fight me on that, and we can have a conversation in the Q&A about that. But that for me clinically is where we go beyond just faith to bolster our faith with medication and with therapy, because when you're clinically depressed, our faith alone is not going to get you through that. And the reason why I'm able to so clearly say that is, I'm using things that are common, so diabetes and high blood pressure. If you are diagnosed with diabetes, you can't just go to Pastor Brian and ask him to help you. Pastor Brian's not going to be able to help you with your diabetes. You're going to take medication that the doctor prescribes, whether it's your metformin, your insulin, and those together with your spiritual faith and your spiritual health will help you to get better going forward. So I think I want us to just think about the fact that if you're clinically diagnosed or clinically experiencing depression, we're going to have to also think about the medication and therapy in addition to our faith and spiritual health to help us to achieve wellness. So one thing I actually want to talk about is the fact that in the US, depression is quite common. So 7% of adults in America have depression. So that's close to 1 in 10 people. So statistically speaking, in the group right now, we have 60 people here. There's a good chance that at least 1 or 2 people, if not at this very moment, at some point in their lives have struggled with depression. The important thing to recognize is depression is not necessarily lifelong. There are people who might have just one depressive episode. There's some people who have recurrent depression where they have multiple episodes over time. But ultimately, if you are someone who's connecting with care, with your primary care doctor or with a psychiatrist, you will be able to overcome your depression with medication, with therapy, and with your spiritual health. And the thing that's really interesting to think here is 65% of people who have depression will seek help from a professional. And that is, again, going to your primary care doctor, psychiatrist, even a psychologist. And what to me is a little scary here is by saying that 65% of people seek help, 35% of people are doing nothing. And my fear is that in this 35% of people, a lot of us might be Christians who are afraid to reach out to help. And the literature actually shows that Christians are more likely, and people of faith in general, but Christians are more likely to actually go to a religious leader. So go to a pastor, go to a counselor in the church when they're dealing with mental health issues than they are to actually go to a primary care doctor. And I think that it's actually incredibly important to be able to feel that you have that comfort level to go to your pastor or to the different leaders in your church when you're struggling with mental illness, but at the same time recognizing that that is not enough, that in addition to doing that, reaching out to medical professionals is incredibly important. So one of the things I want to talk about, because this is actually really important, is the risk factors, because when we're thinking about who could get, how do you end up being the 1 in 10 who ends up having depression? Just in general for mental illness, but especially for depression as well, there are a few major risk factors, and those are your genes, your biology, your environment, and your lifestyle. So genetically, you're thinking about, basically, you're stuck with your genetics. Your parents, they created you, their genes came together, and they created the roadmap for what your genetic makeup is. And based on whichever traits and proteins are expressed, you will be either more likely or less likely to experience depression. But then beyond that, then there's the biology. So I've been mentioning things like neurotransmitters and the different chemicals in the brain that function in such a way to make some people be more likely to have a good mood. If you're someone who has higher levels of serotonin, for instance, or norepinephrine, or even just any of those protective factors, you may be able to just get through challenges in life a little bit more easily than someone who has fewer of those types of neurotransmitters. Our environment, so whether you've grown up in an environment where people are open to talking about these things, or where you've struggled financially or have difficulty finding food, or there's violence in your neighborhood, all of those actually kind of embed into our experience as humans and change our ability to cope with challenges that life brings us. Our lifestyle is another one. So if you have a bad diet, your diet actually is really an important factor in kind of changing some of the brain chemistry that you have. Exercise, substance use, all of these things in lifestyle choices can then impact our biology and how our brain is able to function at its optimal level. So all of these together, and it's not necessarily a way that we can quantify which is most important for a specific individual, but all of these combined can increase or decrease your chance of having depression. The other thing I actually really want to talk about as well is, first, on one hand, thinking about the severity of depression. So what's really interesting in that 1 in 10 percentage, or it's at the 7% actually, but of those people, about 2/3 of them have severe impairment. So going back to what I had talked about before, and I'll actually kind of jump back to that slide really quickly, severe impairment with these signs and symptoms. So whether that's like, some people will get to the point where they're not eating at all. So example I'll give is if you have an elderly person in your family, so someone who maybe, let's say, in their 80s and having depression, what that looks like, what I've seen in the hospital clinically, is someone literally might not eat at all. And their depression might cause them to lose 20, 30, 40 pounds. I just treated a lady who she lost, I think it was about 40, 50 pounds because of her depression, because she was unable to eat, unmotivated, did not have the energy, all of those relating to her depression, physically impacting her and creating impairment. So for 2/3 of people who have depression, they have severe impairment. But then on the other side, on the right-hand side of the slide, you're seeing that of these people, only 44%, so that left side of the slide there, 44% are getting the optimal treatment that is recommended for depression. And that optimal treatment is seeing a health professional and medication and getting medication. And what I will say as a Christian is adding on to that, leaning on your spiritual supports to be able to help support and to help heal from depression. So I wanted to emphasize that because people are suffering. And if you are, or someone you know has depression, I think one of the worst things that could happen is to suffer in silence, and recognizing that, A, you're not alone. I think that for me is one of the things I really like to be able to emphasize is, if you're experiencing this, you're not alone. But more important, that there are ways for us to be able to help and for you to truly be able to feel better. So going into now the last section of this talk before we get into question and answer is the treating of depression. So some of the options that I want us to consider are faith, meds, and therapy. And what I will say is that all three of these together, neither alone. So from a strictly clinical standpoint, doctors will tell you medication and therapy together is the ideal gold standard for the treatment of depression. And I will say, as a Christian doctor, that faith, medication, and therapy, all three of those together, will be the ideal treatment for depression. So here, as I said, we have these three options, and I'll kind of go into what these look like specifically. So when we're thinking about treating depression, first there's faith. What I want us to recognize is that the role that faith plays in depression is the spiritual health standpoint. And what I've been talking about today is this idea that spiritual health and mental health are different, but ultimately they are intertwined. And when your spiritual health is intact, you give yourself the best chance to also then improve your mental health. So what does it look like for faith to play an important role in your mental health? Mostly your faith is going to bolster the spiritual health, which honestly, even from a clinical standpoint, doctors will say that these different components of how faith impacts your spiritual health are actually some of the things that help people to improve best clinically from depression. So with our faith, what that helps us to do is to lean on church community for support. In folks, generally speaking, Christian or not, we always say that leaning on supports is one of the best ways to help with recovery. So as a Christian, thinking of your church community, whether that's for me, it's like young adults. I love the young adults group, the created singing group, praise and worship, even with the women's ministry, to be able to lean on people to help you, to support you through challenging times. I think the next one is being able to discuss challenges with religious leaders. So having someone you can confide in, again, Christian or not, but specifically here when you're Christian, to be able to trust that your religious leaders are going to be there to support you, but then also not to gossip about your experiences. I think that's important as well. Our faith, reading the Bible. So I just went through a bunch of verses, especially the ones where I talked about how our spiritual health is part of our self-purpose, our identity of self, and our connection with our purpose. Reading the Bible is integral because you're going to find encouragement to help you through the difficult times and help you through your depression. getting involved in ministry. So actually one of the things that we always recommend to patients is find things to do. One of the most helpful ways to help guide someone through depression is to be able to not be isolated, to not be kind of just sitting in the house doing nothing. So as a Christian, your faith is improving your mental health because you're being able to get involved, you're connecting with people, you're finding encouragement that is connected with your connection to God, your connection to others, and your sense of self and purpose. Then, so with the faith, that's where now we think clinically. So with medication, and I think a lot of the times people are afraid to take medication for depression. And it's interesting to me because honestly, there's still so much stigma that exists, whether it's within the Black community, within churches, within just all communities, honestly, that against having a mental illness, and that means that there's something wrong with you. And what I really just want us to be able to talk about is that mental illness is no different than your cancer. It's no different than your diabetes. It's no different than any endocrine disease you can have. It's an illness, and it's an illness that we have treatments for that people are able to see like marked improvement in these symptoms. So examples here on the left of antidepressants, these are examples of SSRIs, which are selective serotonin reuptake inhibitors. So I've been mentioning these different neurotransmitters, and what these medications actually help to do is to help to increase the levels of some of those neurotransmitters in your brain so that those chemicals which actually help to induce and help to improve happiness, these medications are specifically targeting those chemicals to increase those levels. So some of these here are the SSRIs, so selective serotonin reuptake inhibitors. Some are SNRIs, selective serotonin and norepinephrine reuptake inhibitors. And what I want to talk about is the benefits and side effects, because any doctor, anytime, for any medication you take, should be telling you benefits and side effects, because as we know from especially all those commercials, that every single medication has side effects, and you have to think about the risk benefit, the risk and benefit of taking these different medications. So here are the benefits of these different types of, whether it's Zoloft, Lexapro, Celexa, these antidepressants, improve mood. When you're depressed, one of, as I said before, the main criteria, it's you're either having hopelessness, depressed mood, or loss of interest. And because these medications help to change the chemical balance in your brain, you can have improved mood, you can sleep better, you start eating better. The same lady that I talked about that I treated very recently, we started her on an antidepressant, and actually one of the antidepressant we chose for her, one of its side effects is increased appetite, which was perfect because she had lost 50 pounds and needed to gain weight. So that's one of the benefits that can occur with antidepressants. And increased energy. And a lot of people will say that they felt like they were in a cloud before starting on an antidepressant, and now they have clarity to be able to just go back to their regular level of function once they're steadily on an antidepressant. And something I'll throw in is, I think the other thing is people are afraid that they'll have to take the medication forever. And honestly, you might. Some people who have diabetes have to take their insulin or take metformin or glipizide or all these other medications. You have to take it every day for the rest of your life. But if you're able to make lifestyle changes, so whether that's you're exercising more or you're improving your diet, you might actually have to stay on that medication for a shorter period of time. So similarly with depression, sometimes someone might be on, let's say, an antidepressant for about a year or so, and then their doctor will start to kind of slowly decrease the dose to see how they do, if they can succeed without it going forward. Or some people, if you're in the category where you have recurrent depression, might need to just stay with the medication, just as someone with diabetes might need to stay on their insulin for a lifetime. And then, as I mentioned, I have to talk about the side effects as well. So depending on which antidepressant you start, you can have nausea, weight gain, decreased libido, dry mouth. These are some examples of some of the side effects that you can have. But the conversation that will be important for you to have with a doctor is weighing the risk and benefit of these side effects compared to the benefits that you can have. And that's what I really want to be able to emphasize here. And then the last component of treatment for depression. So we talked about faith, we talked about medications, and lastly, we're talking about therapy. So when we're thinking about depression, and therapy in particular, I think sometimes people are afraid of therapy and what does therapy mean? What does therapy look like? There are actually so many different types of therapies. And in some ways, the counseling that you might receive from a religious leader or a leader at church is therapy. That counseling tends to fall into the category of supportive psychotherapy, meaning that someone's there listening to you, they're able to hear your thoughts, hear your concerns, they're supporting you, and whether that's kind of giving you advice to help with your self-esteem or to help you learn skills to cope and deal with challenges better. That's kind of more so what like religious counseling is, unless the person is trained in psychology and able to then give other types of therapy. So that could be cognitive behavioral therapy. And with cognitive behavioral therapy, what that talks about is the interconnection between your behavior, your thoughts, and your emotions, how being able to fully understand those three components of ourselves, we can better kind of adjust our actions or adjust our thoughts or emotions to really allow ourselves to be in sync. So that's one of the therapies that exists for depression. And then on the far end of the spectrum, another type we have is psychodynamic therapy. And that's really where the therapist is really able to pinpoint and work on finding the problem areas in your life. So whether that's lifestyle or environment or working through past traumas or things of that nature, that can help you to better recognize and gain insight to your behavior, your feelings, and your thoughts, and then working towards you being able to better cope with the challenges that arise. So I hope that kind of me being able to lay these out of just recognizing spiritual health, mental health, they're different, interconnected for sure, but different. Talking about the fact that how do you recognize what depression is, and then what are the different ways that we can treat it, especially as Christians. I hope that this for you is enlightening, and I hope that it brings also raises up some questions. Some of the last things I want to talk about. So these are adjunct therapies, I would say. So a physician is never going to say that herbal remedies, acupuncture, exercise, meditation, massages, guided relaxation, yoga, that these things in and of themselves can treat depression, but they can help you to feel better and help bolster the medical, the therapy, and faith-based experiences that you have, or those treatments in depression. So just to kind of wrap up the formal part of this, I really want to be able to kind of summarize a few things. So first, spiritual health, mental health, they are different, but very much intertwined. I want you guys to be able to be aware of mood and behavior changes in yourselves and in loved ones, because at the end of the day, depression is impairing. It impacts us in ways where we can't function the way that we want to. And on the worst, the most extreme end of the spectrum, leads to suicide, leads to people taking their lives because they feel so hopeless and so down that they don't see anything out of it. But then I want us to recognize that it's treatable. So I don't want us to ever be afraid of mental illness in a way that this is something that your life is over, because that's not the case at all. Depression is treatable. There's medication, there's faith, and there's therapy that can help us to successfully get through an experience of depression. And as I mentioned, just the faith, meds, and therapy, and how important those all are together. So before we hop into Q&A, I just have a couple of things I wanted to talk about. There are a few additional resources if you ever wanted to look up to learn more about what I said. I mentioned my blog earlier, AtashaJordan.com. I have the Psychiatry in 60 Seconds series there. But here are some national resources as well for you to be able to learn more. There's the Substance Abuse and Mental Health Services Administration. Here's their website and number if you ever wanted to reach out. The National Suicide Prevention Lifeline. So if at any time you ever felt like you wanted to end your life, this is a number that you could reach out to, and they have trained clinicians who are there to support you. And a Philly-specific outreach is Healthy Minds Philly. You can find healthymindsphilly.org. Additionally has resources that go obviously far beyond even just depression, but across the spectrum of mental illness. And for me, if you ever wanted to get in contact with me, here are the different ways that you can reach me. I am on social media a lot. I'm trying to actually be on there less, but I'm on there a lot. Twitter, Instagram, Pinterest, you can reach out to me on either of those. My email address, you can reach me at admin@atashajordan.com or on my website, as I mentioned before. And then lastly, I actually wanted to share this. So you can't really see it. Ooh, I'm going to show. I have this like super sweet sweater It says Jesus plus therapy, because I really do think that in order for us to succeed when it comes to our mental health, we need Jesus and we need some therapy. I could add some meds in there too. But if you wanted to ever get any of this merchandise, I have sweaters, mugs, t-shirts at teespring.com/Jesus plus therapy. There's a QR code there if you ever wanted to get anything. But that's all I have, and I really now just want to be able to kind of open this all up to questions and talk with you guys, see what your thoughts are. If you even just have comments that you want to give, that's great too, because I want now the rest of the time that we have together to really just be a conversation, and I can answer questions if there are any.